Are you feeling sad or down? What's normal and when to seek help? Hi, I'm Dr. Melissa Mandela, a family medicine, lifestyle medicine, and integrative psychiatry specialist, here with FemHealth. Let's dive in. So everyone experiences sadness or low moods from time to time, especially in response to stress, loss, or life challenges. Feeling down occasionally is normal, especially part of normal life, and in most cases, these feelings pass on their own. However, if sadness lingers for an extended period of time and interferes with daily life, it could be a sign of something more serious, like depression. Clinical depression. Understanding the differences between normal sadness and clinical depression can help determine when it's time to seek help. It's completely normal to feel sad in response to disappointments, stress, or difficult situations. Temporary sadness can be triggered by events such as relationship problems, financial struggles, or feeling overwhelmed at work or even at school. This type of sadness usually improves over time, especially with support from loved ones. Self-care can help, and even engaging in enjoyable activities. Even hormonal changes, lack of sleep, or poor diet can cause temporary mood dips. However, when sadness becomes persistent, lasting for several weeks or months without a clear cause, it could indicate depression. Many people wonder, can I be depressed for no reason? And actually, the answer is yes. Sometimes depression occurs without an obvious trigger. Depression is not just about feeling sad. It's actually a medical condition that affects the brain chemistry, also mood regulation and energy levels. Factors such as genetics, chemical imbalances, past trauma, or even chronic stress can contribute to the depression. Even when life seems stable, you may have depression. Unlike temporary sadness, depression often includes additional symptoms like loss of interest in activities, changes in appetite or sleep patterns that are different, even difficulty concentration, and feelings of worthlessness or hopelessness. If these symptoms persist for 2 or more weeks, it may be a sign of clinical depression. It's important to seek help when sadness starts to interfere with your daily life, at work, relationships, or even you may be neglecting your self-care. If you find yourself withdrawing from your loved ones, not wanting to go out, or you're struggling to get out of bed, you might not be interested in the things you once loved or the things that made you happy. These are truly red flags. You need to seek professional support, and that may be needed at the time. Another warning sign includes increased irritability, frequent crying, extreme fatigue, or thoughts of self-harm or suicide. Depression is treatable, and that's the good news, and early intervention can make a big difference in recovery. Speaking with a doctor, therapist, or counselor can help identify the best treatment plan. Whether it's therapy, lifestyle changes, or medication, if needed, it's important for you to seek help. Feeling down occasionally is part of life, but when sadness becomes overwhelming and persistent, or even without clear causes, it may be time to seek help. Depression is not a sign of weakness, and getting support can lead to better coping mechanisms and better strategies to improve your mental health and overall well-being. Whether through professional treatment, lifestyle changes, or support from friends and family, no one has to struggle alone. Recognizing the difference between temporary sadness and depression can be the first step towards healing and feeling better. Thanks for watching. Subscribe so you don't miss more educational content for you by doctors at FemHealth.